Introduce Susanna Rogers, our speaker today. Susanna is with Runner's Edge, and full disclosure, we're old friends, and so it's really nice to have her here with us today. Susanna is amazing. I mean, she's not only been an elite athlete herself, but as through her physical therapy practice, she's continued to work with the U.S. national team with skiing and also with the Olympic team. So Susanna has now started working with Runner's Edge, and she is introducing telehealth and telemedicine into that physical therapy practice. And it is really cutting edge. This is new, and most people assume that physical therapy, because it's such a hands-on profession, would not be able to be provided through telehealth, but that's in fact not true. So what I'm going to do is turn this over to Susanna, let her introduce herself. And Susanna, I will just ask you at the end for some questions, for some time to answer some questions, but meanwhile, I'll hand it over to you. Thank you for coming.
Thank you, Jackie, and thank you, Kim. It's so good to be here. And, you know, when I was invited to do this talk about a month ago or so, I was looking for an appropriate topic, and it was maybe last year that I was being tasked to bring telehealth to our clinic, to the Runner's Edge, Alaska. What I did not know is how huge impact it's going to have to our practice and really how we can extend our services to the community. So let me tell you a little bit about Runner's Edge, Alaska. It's a relatively new physical therapy clinic that started just last year. And we are concierge mobile and telehealth physical therapy clinic. And the original owner thought to fill kind of the gap between rehabilitation and performance in Alaska that people were still missing. So that's where we stepped in. And providing mobile services has been actually really, really good. So in adding telehealth, we extended these services to really pretty much whole Alaska. And our perfect patient population is more the active population, or people who want to be active, but also we're general orthopedics and sports physical therapy clinic as well. So let's talk about telehealth. You know, right now we know that it's probably becoming a necessity, especially if we follow what the rest of the world is doing and closing our schools and closing clinics. So I was really, really excited to present this topic, and maybe we can kind of take the direction of, okay, what needs to be done to be able to provide telehealth services in Alaska? And also from the standpoint of the patient, how in the world can a physical therapist provide telehealth services? Because originally physical therapy professional has been the hands-on professional. We had to touch people to make them better. So here's the question: what is telehealth? Very simple answer. Telehealth is providing health services or physical therapy services through any kind of screen. It can be a computer screen or it can be a smartphone. And it's really, really fast growing for both the patients and providers. For example, Runner's Edge Alaska right now serves the whole Alaska with telehealth services. And we see a lot of active folks from the communities that are not connected to the road system. The patients or people, clients really, are looking for expertise in the area that might not have access in their village or their city. So that has been really, really good. There is really growing demand for telehealth services. And if you think about it, you know, one of our patient population is moms with kids at home. Well, you can't find a babysitter for 2 hours, get ready to go to physical therapy appointment, be at the PT appointment and come home. And by the time you're trying to scramble to figure out what exercises, what kind of self-care you're going to do for yourself. So we really like to see our clients in their own environment where they are and help them with the tools that they have at home. The other great population is somebody who is maybe training for a sporting event and they might be traveling around the state, or they might not have that much time to go to physical therapy office, they can just log in into their computers or a smartphone and have a session during their lunch break in their office. So that has been excellent as well. The access to telehealth services is growing, and just as of yesterday, there is big push from insurance companies and from medical groups to provide telehealth services, or to be able to provide telehealth services to keep our population out of the crowded offices and physical therapy clinics. Reimbursement is getting better, and it all depends on the insurance companies. For example, as of yesterday when I looked, Medicare and I think Medicaid also were not reimbursing for telehealth services for physical therapy, but there's a big push from our Physical Therapy Association to being able to do so, because there's going to be probably quite a bit of demand on that. Private insurance companies, let's say Primera, Aetna, maybe Cigna, and I don't know what else is there, they are starting to reimburse for telehealth services, but it all depends on the plan. For these reasons, Runner's Edge Alaska is a out-of-network or cash-based physical therapy practice. And that means that we don't make distinction on whether the person has insurance or what kind of plan they have, of course, except Medicare, because that's a whole another pot of coffee there. But we're able to provide services not limited by insurance restrictions. And when we see a patient, we pretty much give them a super bill so they can build their own insurance. It's usually reimbursable on out-of-network benefits. So it really works well both sides, and patients are really happy because they feel like they have control over their healthcare as well. So how can a physical therapist provide telehealth services without really using our biggest tools, right? So physical therapists are really movement specialists, and we have many tools in our tool bag that we can assess and help the patient to get well, whether it is getting stronger, getting less pain, being more independent. A lot of people come to us because they fear of losing independence or fear of losing the ability to continue with their activities that they love to do. And for that, you don't really need hands-on approach. A lot of treatment really comes from understanding where the client is coming from and what their current situation is and what their goals are. So for example, we can diagnose low back pain through movement, and we can do that through the screen. I can demonstrate the movement and I can see the patient performing the movements, and I can assess whether there is any kind of compensation or anything that needs to be changed. And then we can get them to do some home care, home exercises to get that resolved. So really the treatment empowers our clients to get better independently without the help of other hands-on therapists. So it's been really, really nice, and people appreciate it. So what we see here, this is, I think, from 2018, the telemedicine part of things is growing so rapidly. And we can see it in rural Alaska already, where primary care physicians are really seeing patients on telemedicine basis with a health aide present in the clinic. And I think the physical therapy right now is in the others category. It's still really, really small. And it can be because there are some barriers of really getting that telehealth option out there. So really, telehealth is really unexplored in physical therapy, but it's growing fast, especially when we're starting to realize how much impact we can have on our population. For somebody who's trying to set up a telehealth clinic or provide telehealth services, there are definitely some regulations and laws that we have to follow. One of the biggest one is the practitioner, or let's talk physical therapists, have to be licensed in a state where their patient is currently. So for example, if I am in Alaska, I can only see patients in Alaska. If I travel to Colorado, I can still see patients that are present in Alaska. But if my patients travel to Colorado, I cannot see them because the laws of the states are a little different in each state, depending on treatment and reimbursement and all that other areas. So it's very important to really follow wherever our listeners are from which state. They really have to read the laws and regulations and the Practice Act of the state they want to practice. Lower 48 has created what's called a telehealth compact. What that means, there are several states in Lower 48 that are part of one license provision pretty much. So if, and I don't remember exactly what states are in the compact, but if a physical therapist has a license in one state, they can see patients in all the neighboring states that are part of the compact. Alaska, unfortunately, is not part of the compact, but it has been proposed. So it would be something to watch closely to see what happens in the future. Alaska also is, I think, a little bit ahead of lower 48 states because we do have a business registry for telemedicine, and everybody, healthcare practitioner who wants to practice telemedicine in the state of Alaska needs to be registered with through the Department of Commerce. And I put a link in there. It's really easy application process. It takes about 4 weeks, but I think they might speed it up a little bit depending on current situation. And it only costs about $50. But what it does, it lists all the providers that are able to provide telemedicine in one site, which is a nice resource. The license really never expires. When I did a search on the telehealth, telemedicine registry, there's only about 10 physical therapy clinics that are registered, and only maybe 2 or 3 are providing active telehealth services through their website or so. So, you know, if we can spread the word in Alaska, I think telemedicine is gonna explode because it's such a valuable service. So as I said before, reimbursement really varies and it depends on the insurance company. So we really advise our clients prior our services, if they want to bill their insurance for telehealth services, they need to call them and see what the benefits are. There are 3 ways that telehealth can be provided. And the most common one is the live video. It's pretty much like you and I, we're on live call and I can ask you physical therapy questions, demonstrate exercises and see how you're moving. So it's one-on-one interaction in real time. There's also store and forward. So for example, this presentation is going to be recorded and a client can listen to it and see it later on. So that's the store and forward method that sometimes is reimbursed and sometimes it's not. And then remote patient monitoring is getting more and more popular, that when people wear health trackers, health monitors like a smartwatch or a cardiac monitor, so the physical therapist can monitor what the patient is doing once a day or every other day or so. The patient satisfaction is usually really high because as we talked about, you know, it saves time, saves travel time. We're seeing patients from all over Alaska, so they don't really have to come and see us. And it really extends the reach of a physical therapy clinic to be able to help larger population, especially if the clinic is very specialized, say vestibular physical therapy or sports physical therapy or fall prevention and areas like that. So this is a little bit busy table, but it really tells you what state of Alaska, where state of Alaska is within the telehealth, telemedicine side of things. So we do have telehealth statutes, and everybody who wants to practice telehealth in the state of Alaska needs to read those. Reimbursement is still, we don't know. So it's worth to watch that development. The unrestricted originating site is really nice because the physical therapist, like you yourself, you want to be on vacation or somewhere in lower 48 instead of Hawaii, you can see patients in Alaska. Yeah. And there are more and more studies that are being published right now on the effectiveness of physical therapy. This study really told joint replacement. People have trouble coming to outpatient physical therapy clinics because it takes you a very long time to get ready. You know, you're probably wearing your pajamas that you're comfortable with. You don't want to change into something that's presentable in a physical therapy clinic. And then your home environment is a place where you as a patient with total joint replacement will be doing your exercises. So if a physical therapist is able to assess your home environment and assess how your knee looks like, how you're walking, we can really provide this invaluable service just to get you not leaving the house and do your exercises, do your physical therapy at home pretty much. On the other hand, though, if there is something that is not 100% worth to do or that is not appropriate for 100% telehealth visits, us as physical therapy providers, where we have the ability to either bring you to our clinic if it's a hybrid clinic, or refer you to hands-on physical therapists, or really refer you to a physician if needed. So it's really nice to have the community of providers providing different services. So what do we need? Really, in a nutshell, providing physical therapy through telehealth is super simple. Just like you and I are talking through TV screen, through computer screen right now. All what we need is internet, some kind of monitor, and some kind of microphone. So I'm using just regular old Mac headphones, and the sound quality seems to be okay. With patients, they can even use their cell phones, smartphones, they can log into the computer. It doesn't really matter. It works either way. So if we dive a little bit deeper from the clinician standpoint, we need to have some kind of room that has good sound quality, but also no distractions because of the privacy policies. We have to be able to talk to you as a client one-on-one without just people walking by. Computers, they don't really matter whether they're newer or older, but the internet needs to be pretty fast. So we can really stream other things, can have your telehealth at the house with kids streaming YouTube videos and such because it slows it down. Nice lighting is good, especially if you're in a dark room, and especially if me as a physical therapist, if I start moving back and showing exercises, we need to be able to see each other pretty well. And that's pretty much it. There is not much that's needed from the technical standpoint. A website are good to be able to bring your clients to you, and some websites allow scheduling link that will link you to the system that you're using. And I know we talked about BlueJ. There's the Zoom is really appropriate for telehealth. There's a way that you can schedule your clients through your website that coordinates with your calendar. And Runner's Edge Alaska is using electronic health records platform, which is PT Everywhere, that has everything that we're talking about integrated under one system, which has been really, really helpful. And then you need some payment process and like a credit card reader or a Square, or there's many different ways to do that. A lot of people are going simple and using Zoom for telecommunication and G Suite for note-taking, and that all can be done under HIPAA compliant way. And I'll be happy to answer more questions. I'm not by all means no expert, but I've learned a whole bunch of things during this process. So, the ask I have to the community is, let's help each other as a medical providers to get through the barriers. Right now, the public really doesn't know about the opportunities that lie in front of them. to get help through computer screen, through telemedicine or telehealth. So my ask to you is, let's spread the word. Let's get maybe a newspaper or news station involved and let people know that we are here to provide services. And I'm very, very happy to show how that's done and answer questions from provider services as well, and bring resources if physical therapists want to hop on telehealth and show them how to do that. It's really, really simple. The uncertainty in this time is, kind of like a double-edged sword, because we don't know what's going to happen next 2, 3, 4 weeks, but also the uncertainty of people who might be receiving telehealth. They don't know what kind of reimbursement they might get, what kind of outcomes they might get. So it's learning situation both ways, especially now. So what I did is I put in a whole bunch of resources. There are already clinics in lower 48 that provide only telehealth services, and they're really, really good at it. There are many resources for healthcare practitioners and physical therapists to learn how to do that. There are many, many documents and videos on how to assess certain conditions, how to prescribe exercises without touching the patient. So the learning resources are there. Domain registrations, payment processing, all that. There's just an amazing wealth of resources out there.
Wow, Susanna, you've been so very generous with sharing all these resources. I'd like to, we only have a few more minutes, and so I want to make sure that there's enough time for questions. One question I have right away is, I'm presuming that you're speaking to other physical therapy groups or things, because they could really use those resources.
Yes, absolutely. And setting up telehealth is very, very simple. I'm more than happy to answer questions from groups that I'm not in contact with.
Okay, awesome. Well, now I'd like to open up some questions to our Health Tie stakeholders. Is there anybody joining us today that would like to ask Susanna a question?
Yes, if you can hear me, this is Carolyn Brown from Juneau. I have 2 questions for you. The first one is, do you anticipate that if telehealth becomes a real operable entity throughout Alaska, you're going to have a compact for that? And if so, that usually takes a legislative maneuver. Do you anticipate that happening? My second question is, if, when, and where we ever get universal health care, do you consider that telehealth PT will be a part of the laundry list of services provided? Thank you.
Thank you, Caroline, for the question. Your first question, whether Alaska will be part of the compact, I think it will be. I don't know how long that's going to take. I forgot to put it on the slide, but there are maybe 10 to 13 states in lower 48 part of the compact yet. And I know there has been talk in the legislature to include Alaska, but I don't know where we're in those talks.
Has that legislation been introduced in Alaska yet?
I'm not sure, but I can get back to you. Yeah, I'm not sure. I know there's a talk, but I'm not sure whether it has been or not.
Okay, second question, go ahead.
Yeah, the second question, I think so, because it really saves money and resources in many different ways. And if we have universal healthcare, we can provide really good specialized services the larger area. For example, if we have people in Barrow that need physical therapy services and they don't have enough physical therapists, that we know they don't, to provide those services there. And if our patients have health aides that are helping with their regular daily activities at home, we can really teach the health aides to do the exercises to care for them from physical therapy standpoint. So, and I think compliance will be a lot better by providing telehealth services, because we'll be able to see them, help them in their own environment.
Thank you.
Right. Kai, I see that you have a question here. Do you want to ask it yourself?
I'd be glad to. Thanks. I've enjoyed the work you're doing and understanding how much is actually available in Alaska. I'm curious, though, in the immediate present situation, knowing that maybe there's going to be people who can't attend their regular PT appointments or doctors who are restricted in their travel, and maybe we get to a point where we don't want people going to public waiting rooms and that sort of thing. Is there a way for this tele-PT to be spun up very quickly to offer some sort of bridging opportunity for folks that say, you know, I'm in a self-quarantine, I can't go to my appointment, but I don't want to wait 2 weeks before I get back on my PT, to give them some sort of solution and maybe a quick entrepreneurial opportunity for someone to step into this space?
That's a fantastic question and really timely, Kai. Thank you. And so the answer is yes. We are Runner's Edge is an out of network cash-based clinic, so I'm not getting many insurance requests, but I know my colleagues from Lower 48 are already getting requests from insurance companies to speed up and start providing physical therapy services with links on how to do that. So I know TRICARE is trying to do that in Lower 48, and I think there are talks about Medicare starting to offer or reimburse telehealth services. So one way to spearhead it really is me talking to you guys and maybe asking questions, how can we do that? Because my reach is pretty small. It's just in my community, my physical therapy community. But if we start talking about it and educating the public and spreading the word, I think there's going to be a lot more way to spearhead this in larger circles. And that's my ask. If I can ask for this organization to help with that, I'll be more than happy to be part of it.
Well, thank you, Susanna. We've got just a couple of minutes left, so I'd like to wrap this up and encourage everybody. Susanna has very graciously put her contact information on the screen, so please reach out to her if you have any further questions. And those of you who have contacts with medical associations and physical therapy clinics, please do pass this on. I think those of us in the entrepreneurial community should really consider that this really is cutting edge, and that we should highlight the entrepreneurial aspects of this process. And let's move forward, as you said, Susanna, and support one another during this time, and just highlight what we can do, even when we're stuck at home. So.
Absolutely. And also from the other side too, our public doesn't really know what telehealth is and how to access that. So educating our public is going to be huge as well.
Oh, absolutely. Thank you for sharing that. All right. Well, thank you, HealthKai community. I want to say a gracious thank you again to Kim, who is always supportive and helping us with the chat and running the webcam. And thank you all for joining us today. And we'll see you in 2 weeks for another Open Innovation Thursday. So thank you.
Thank you for having me.